What if some of the medications you take every day could be affecting your heart without you even realizing it? Not rare medications, not extreme treatments, but common, widely used medications, the kind many people over 60 take regularly, for blood pressure, for pain, for colds, for sleep. Now here's the part most people don't expect. Even when these medications are necessary, and even when they're prescribed, some of them may have effects on how your heart functions, especially over time or in certain combinations. And in many cases, people don't notice anything right away. No dramatic symptoms, no clear warning signs, just small changes that are easy to overlook. My name is Dr. Adrian Keller, and in my work with patients, I've seen this more times than I can count. People doing everything right, taking their medications as directed, but never being told how those medications might interact with their heart over time. In today's video, I'm going to walk you through 9 common medications that may affect your heart after 60 and what you should be aware of, without causing unnecessary concern. Because when it comes to your health, awareness isn't about fear, it's about making informed decisions. Let's take a closer look. Before we go any further, I want to make something very clear. This video is not about telling you to stop taking your medications. In fact, many of the medications we're going to talk about play an important role in managing health conditions, and in many cases they are necessary. But here's what's often missing: context. Because every medication has effects on the body. That's how they work. And sometimes, those effects extend beyond the main condition they're treating, especially as we get older. After 60, the body processes medications differently. Changes in metabolism, circulation, and kidney function can all influence how a medication behaves over time. And when multiple medications are involved, those effects can become more complex. This doesn't mean something is wrong, it simply means that awareness becomes more important. I often tell my patients, taking the right medication is important, but understanding how it affects your body is just as important. Because when you understand that, you're in a much better position to recognize changes, ask the right questions, and work with your doctor to make the best decisions for your health. Now let's look at one of the most common assumptions people make and why it can sometimes be misleading. One of the most common assumptions I hear from patients is this: if a medication is prescribed, it must be completely safe. And I understand why people think that. You trust your doctor, you follow instructions, you take the medication as directed. That's exactly what you should be doing. But here's the part many people don't realize. Safe doesn't mean without effects. Every medication works by changing something in your body. That's how it helps. But those same mechanisms can sometimes influence other systems as well, including your heart, especially when you've been taking it for a long time. The dosage changes, or it's combined with other medications. I often explain it like this. Imagine adjusting one setting in a system and seeing small changes in another part of that same system. Not necessarily harmful, but noticeable, and sometimes important. And this becomes even more relevant after 60, because the body is no longer responding in exactly the same way it did years ago, which means that even familiar medications may have different effects over time. Now let's take a look at the first group of medications, because this is one I see very frequently, and most people never connect it to their heart. The first group includes some of the most commonly used medications out there: anti-inflammatory drugs, things like ibuprofen, naproxen, medications people take for joint pain, back pain, or everyday discomfort. Many of my patients use them regularly, sometimes for years, and often without thinking much about it. Now, these medications can be very effective for managing pain and inflammation, but in some cases, they can also affect how your body handles fluid and blood pressure, which is where the connection to your heart comes in. I've had patients tell me, "Doctor, I only take it when I need it." And that may be true, but when use becomes more frequent, or when it becomes part of a routine, those small effects can begin to add up. Some anti-inflammatory medications may contribute to fluid retention, and in certain situations may also influence blood pressure levels, not dramatically, not overnight, but over time. And when that happens, your heart has to work a little harder to manage those changes. Now again, this doesn't mean you should avoid these medications entirely. It simply means be aware of how often you're using them and how your body responds, because something that feels routine can still have an impact. Now let's move to another type of medication, one that many people take without even thinking of it as serious, but can have a noticeable effect on the body. The next category is one that almost everyone has used at some point: decongestants, The kind of medications you take when you have a cold, a blocked nose, or sinus pressure, they seem harmless, temporary, over-the-counter, easy to take without much thought, but here's what many people don't realize. Some decongestants work by narrowing blood vessels. That's how they reduce swelling in your nasal passages and help you breathe more easily. But that effect doesn't only happen in your nose. It can affect blood vessels throughout your body, which means, in some cases, it may lead to a temporary increase in blood pressure. I've seen patients take these medications for a few days and notice things like a slightly faster heartbeat, a feeling of pressure, or just feeling off without knowing why. And they never connect it to the medication. Now, for most people, this effect is temporary. But for someone over 60, especially if they already have high blood pressure or heart concerns, it's something worth being aware of. This doesn't mean you should never use these medications. It means you should use them carefully and consciously, and always pay attention to how your body responds, because even short-term medications can have short-term effects that matter. Now, let's move on to another group. This one is less obvious, but shows up more often than people think. The next group isn't defined by a single name. It's defined by a pattern, medications that can lead to fluid retention. And this is something many people notice, but rarely connect to what they're taking. You might see it gradually. Your shoes feel tighter by the end of the day. Your socks leave deeper marks around your ankles. Your legs feel heavier than usual. And most people assume, I've just been on my feet too long. It's the weather. It happens with age. And sometimes, that's true. But in some cases, certain medications can influence how your body manages fluid. That includes medications used for things like blood pressure, hormonal treatments, or even certain pain or anti-inflammatory therapies. They can affect how your kidneys regulate fluid or how your body holds onto sodium and water, and when that happens, fluid begins to accumulate, not dramatically, but gradually. I often explain it like this. It's not about one moment, it's about a slow shift in balance. And when that balance changes, your heart has to adapt to the increased volume, which means more work. Again, this doesn't happen to everyone, but when someone notices persistent swelling, especially alongside fatigue or shortness of breath, it's worth considering whether medication could be part of the picture. Now let's look at another category. This one tends to surprise people the most. This next category tends to surprise people the most. Antidepressants. Now these medications can be extremely important. They help many people manage mood, anxiety, and overall mental health. But like any medication, they can also have effects beyond their primary purpose. In some cases, certain antidepressants may influence heart rhythm or blood pressure. Not in everyone, and not always in a noticeable way, but in some individuals, especially over time, these effects can become relevant. I've had patients tell me, "Doctor, I've been feeling a slight flutter in my chest. Nothing painful, just different." And they never connect it to their medication because it doesn't feel obvious. It's subtle, and that's what makes it easy to overlook. Some medications in this category may affect how electrical signals move through the heart, and when that happens, you might feel things like a slightly irregular heartbeat, a faster pulse, or just a sensation that something feels off. Again, this doesn't mean these medications are unsafe. Far from it. It simply means that, in certain cases, they may have additional effects that are worth monitoring, especially if something feels new or different from your normal. Now let's move on to another category, one that's very commonly used, but often underestimated. The next category includes medications that many people use for inflammation and immune-related conditions. Corticosteroids. These are often prescribed for things like joint pain, respiratory conditions, or inflammatory issues, and they can be very effective. But they also have a well-known effect on the body. They can influence fluid balance and blood pressure. In some cases, they may cause the body to retain more sodium and water, which can lead to mild swelling, a feeling of heaviness, or changes in blood pressure over time. And just like we talked about earlier, when fluid levels increase, your heart has to manage that extra volume. It doesn't stop working, but it works harder. I often tell patients, it's not just what a medication treats, it's how it shifts the balance inside your body. Now, not everyone experiences these effects, and for many people, corticosteroids are necessary and beneficial. But when they are used over longer periods, or at higher doses, these changes can become more noticeable, which is why awareness matters, because when you recognize small changes early, you're in a better position to respond. Now let's move on to another category. This one is often overlooked because it doesn't even feel like a heart-related medication at all. The next category is one that almost nobody thinks about: antacids, medications used for heartburn, acid reflux, or stomach discomfort. They feel harmless, simple, over-the-counter, something people take without a second thought. But here's what many don't realize. Some antacids contain significant amounts of sodium, and not in a way that's obvious. You don't taste it like salt in food. You don't notice it right away. But it's there, and when these medications are used regularly, that extra sodium can begin to add up. I've had patients who were carefully watching their diet, reducing salt in their meals, but still consuming higher levels of sodium than expected. And the reason? It wasn't the food. It was the medication. Because sodium doesn't only come from what you eat, it can also come from what you take. And as we've already discussed, higher sodium levels can influence fluid retention and blood pressure, which over time can affect how much work your heart has to do. Now again, this doesn't mean antacids are harmful. They serve an important purpose. But if they're used frequently, it's worth being aware of what's inside them, because sometimes the effects don't come from where you expect. Now let's move on to another category. This one becomes especially important when medications are combined. The next category involves medications that can influence heart rhythm, and this is one of the most important areas to understand, because your heart doesn't just beat, it follows a very precise electrical pattern, a rhythm, and certain medications, in some cases, can affect how that rhythm is regulated. This doesn't happen with everyone, and often the effects are mild, but in some individuals, especially after 60, these changes can become more noticeable. I've had patients describe it like this: my heart feels like it skips a beat. Sometimes it feels faster, then normal again. Nothing painful, just different. And again, they don't always connect it to their medication, because the change is subtle. Now, medications that may influence heart rhythm can include certain antibiotics, some antidepressants, and other medications that affect electrical signaling in the body. In most cases, these are safe when used correctly, but when combined with other medications, or when the body responds differently over time, the effect on rhythm may become more noticeable. That's why awareness is key, because when something feels new, even if it's mild, it's worth paying attention to. Now, let's move to another category. This one is less about a single medication and more about something many people experience without realizing it. The next point is not about a single medication, it's about combinations, because in many cases, it's not one medication that affects the body, it's how multiple medications interact with each other. And this becomes especially important after 60. Many people are taking more than one medication for blood pressure, for cholesterol, for pain, for sleep. Individually, each one may be appropriate, but together, they can create effects that are not always obvious. I've seen situations where patients say, "I've been taking these medications for years, nothing changed." But over time, as new medications are added or dosages are adjusted, the way the body responds begins to shift. I explain it like this: each medication is like a small adjustment in your system. One adjustment may not feel significant, but when several are combined, the overall effect can become more noticeable. Sometimes that means changes in blood pressure, changes in heart rhythm, or increased fluid retention. Again, not necessarily dangerous, but important to recognize, because these effects don't always come from something new. They can come from how things are combined, which is why I always tell my patients, don't just think about what you're taking, think about everything you're taking together. Now let's look at one final point. This one is often overlooked, but can make a real difference in how your body responds. The final point isn't about a specific medication, it's about time, because sometimes the effect doesn't come from what you take, but from how long you've been taking it. I've had patients tell me, "I've been on this medication for years and I've never had a problem." And that may be true, but the body changes over time. What worked the same way 5 or 10 years ago may not behave exactly the same today. After 60, your metabolism, your circulation, and how your body processes medications can all shift. And when something is taken consistently over long periods, even small effects can begin to accumulate. Not suddenly, not dramatically, but gradually. I often describe it like this: it's not one drop of water that fills a glass. It's the accumulation over time. And with medications, that accumulation can sometimes influence how your body feels and how your heart responds. Again, this doesn't mean long-term use is harmful. Many medications are designed to be taken long-term. But it does mean that periodic evaluation matters, because what was appropriate years ago may need to be adjusted over time, and recognizing that is part of staying proactive about your health. Now let's talk about what you should actually do with this information, because this is where everything comes together. So what should you do with this information? The first and most important thing is this: do not stop taking any medication on your own, even if you recognize one of the categories we talked about. These medications are often prescribed for a reason, and stopping them abruptly can do more harm than good. Instead, the goal is awareness. I tell my patients this all the time. It's not about fear, it's about understanding. Because once you understand how something may affect your body, you're in a much better position to respond appropriately. The second thing is to pay attention to changes. Small things, like new swelling in your ankles, a change in your heartbeat, feeling more fatigued than usual, or anything that feels different from your normal baseline. These are not reasons to panic, but they are reasons to observe and take note. And the third is to have the conversation. If something feels off, or if you're taking multiple medications, bring it up with your doctor. Ask questions. Review your medications together, because sometimes a small adjustment, a change in dosage, or even switching to an alternative can make a meaningful difference. And finally, keep track of what you're taking. Not just one medication, but all of them, including over-the-counter products, because, as we discussed, it's often the combination that creates the effect. And when you have that full picture, you're in control. Now let's bring everything together. So let's bring this together. The goal of this video was not to create concern, but to create awareness, because medications play an important role in managing health, especially after 60. But like anything that affects the body, they can also have broader effects, sometimes subtle, sometimes gradual, and often easy to overlook. We talked about common pain relievers, cold medications, medications that affect fluid balance, hidden sources of sodium, changes in heart rhythm, and even how combinations and long-term use can influence your body over time. None of these on their own automatically mean there is a problem, but together they highlight something important. Your body is constantly adapting, and the more you understand how it responds, the better decisions you can make, not out of fear, but out of clarity. Because the most powerful thing you can do for your health is to stay informed, pay attention, and work with your doctor when something changes. If this video helped you, share it with someone who might benefit from it. And if you want more clear, practical insights like this, focused on helping you understand your body and protect your health, make sure to subscribe. I'm Dr. Adrian Keller. Stay aware, stay informed, and take care of your heart. I'll see you in the next video.